Ogilvie syndrome is a rare medical condition. It affects the large intestine, also known as the colon. The colon becomes significantly enlarged. This enlargement is not caused by a physical blockage. Instead, it's due to a problem with the nerves or muscles that control the colon's normal movements. Imagine the colon as a muscular tube that usually contracts and relaxes to move waste products along. In Ogilvie syndrome, this coordinated muscle activity is disrupted, causing the colon to expand like an overinflated balloon.
This condition is also called acute colonic pseudo-obstruction. Pseudo means false, so the name highlights that there's no actual physical obstruction. The problem lies in the nerves or muscles that regulate the colon's ability to contract and push contents through. This disruption can occur for various reasons, which we'll delve into later. Recognizing Ogilvie syndrome is crucial because if left untreated, the consequences can be serious.
Several factors increase the risk of developing Ogilvie syndrome. Hospitalization, especially for extended periods, is a significant risk factor. Surgeries, particularly those involving the abdomen or pelvis, can also disrupt the delicate nerve and muscle function in the colon. Trauma, such as a car accident or a fall, can have a similar effect. Severe infections that affect the body systemically can also increase the risk, as can certain medications like narcotics or anticholinergics. The symptoms of Ogilvie syndrome are usually quite noticeable. The most prominent symptom is abdominal bloating. The abdomen can become visibly distended and uncomfortable. Pain in the abdomen is another common symptom, ranging from a dull ache to sharp cramps. Nausea and vomiting may occur as the colon struggles to empty. Constipation, often severe, is another hallmark of the condition.
Diagnosing Ogilvie syndrome starts with a thorough medical history and physical examination. Doctors will ask about recent hospitalizations, surgeries, medications, and any other medical conditions. Imaging studies are crucial for confirming the diagnosis. Abdominal X-rays can show a significantly dilated colon. However, Connecticut scans offer a more detailed view and can help rule out other possible causes of the obstruction. Early recognition of Ogilvie syndrome is vital to prevent serious complications. One of the most concerning complications is ischemia. This occurs when the blood supply to the colon is compromised due to the excessive stretching. Ischemia can damage the colon's wall, leading to tissue death. Another serious complication is perforation, which is a hole in the colon wall. Perforation is a life-threatening emergency that requires immediate medical intervention.
Treatment for Ogilvie syndrome depends on the severity of the condition and the individual patient's overall health. Conservative measures are often the first line of treatment. This includes close monitoring, intravenous fluids to prevent dehydration, and stopping any medications that could be contributing to the condition. A thin tube may be inserted through the nose and into the stomach or small intestine to relieve pressure by removing air and fluids. Medications that stimulate colon contractions may be prescribed to help the colon regain its normal function. In some cases, a colonoscopy may be necessary. This procedure involves inserting a thin, flexible tube with a camera attached into the rectum and colon. Colonoscopy can be both diagnostic, confirming the absence of a mechanical obstruction, and therapeutic, as it can sometimes decompress the colon. Surgery is rarely required, reserved for cases where other treatments have failed or complications arise.
Understanding the treatment options and outlook for Ogilvie syndrome is essential. Early intervention can significantly improve outcomes, and knowing what to expect can help patients and their families navigate this challenging condition with more confidence.